The number of children being prescribed psychotropic or mind-altering drugs grows every day. Healthy Day News reports 1 out of every 13 children is taking at least one medication for emotional or behavioral issues. 55% of parents believe the drugs are working. 26% say they help some, and 19% say the drugs don't work at all.
Additionally, the CDC's most current statistics show 6% of all U.S. adolescents ages 12 to 19 have used a psychotropic drug in the past month, and boys are more likely than girls to use them, especially for ADHD.
So with so many of our kids using them, you want to make certain it's right for them. And to help us determine that is Rosemary Collins, who is a psychiatric nurse practitioner with 3 Lower Counties Community Services. Thank you so much for coming in today.
Thank you.
My first question, why more boys than girls?
Well, boys typically exhibit more hyperactivity and impulsivity, so they're seen in the classroom as being more disruptive, talking a lot, being a class clown, and being a disturbance.
Right.
So they are more, they're referred more by the teachers.
So how do you know if your child needs medication or not?
Well, the first thing you need to do is have a psychiatric evaluation or be evaluated by a primary care physician for ADHD. Usually the teachers refer them to either their primary care or to a specialist. We complete an evaluation, rule out any medical conditions or any vitamin deficiencies or any other things that could be contributing to why the child is behaving that way, and then we determine if medications is an option.
Okay, so boys are diagnosed more often, but girls aren't immune.
No, girls tend to exhibit the inattentive type, which is being distracted easily, unfocused, underachievement. They tend not to exhibit the hyperactive, impulsive type, but there are girls that do that. It's not exclusively a boy's diagnosis.
Right.
It's just that they're not seen as often exhibiting those symptoms.
Okay, so it's determined that your child needs medication. Not all medications are created equally. There may be some trial or error. And what do you say to parents who don't want their child to be, I guess, a guinea pig? I mean, how do you figure out what's right for them?
Well, patient education and family education is key. You make sure that you are realistic with the parents and letting them know that the medication is to help treat the ADHD symptoms, not to make their child a good child versus a bad, no longer being a bad child. So that's usually what they come in and say, my child is misbehaving, they're bad.
Right.
And so making sure they understand what the medication can and cannot do. The medication will help them focus better, be more able to complete tasks, but if they're having behavioral problems such as being disrespectful, the medication will not change that. And that's very important because that's usually one of the key things that parents are hoping to change.
Right. So are there other treatments besides medication?
There's cognitive behavioral therapy. The biggest thing again is patient education with families and the teachers to understand what is very realistic with using medications. Also, there's alternative approaches, prescribed medications as opposed to stimulants or other medications that we can use.
Now, if your child is put on a medication, are they on it for the rest of their life, or can they grow out of these conditions?
ADHD symptoms can be, teenagers can grow out of ADHD, and you don't have to be on the medication lifelong. Sometimes parents at one point in time feel that they no longer want their children on the medications, and at that time we tend to taper them off, or they're already off the medications, and we talk about other avenues in treatment.
Okay, so you talked about stimulants. A little bit earlier we talked about the abuse of stimulants. Is there some way that we can tell the difference between somebody who needs the drug and somebody that just wants the drug?
So for teenagers or adolescents, the biggest thing is if you are suspecting that they're abusing the drug or wanting to abuse the drug, they tend to come in and know what medications they want to take. Specifically, they're looking for a immediate release Adderall as opposed to something like Strattera or Clonidine or Concerta, even though many of them as stimulants can be abused. It's Adderall's the most widely abused stimulant in adolescents and adults.
Right.
Are there side effects with these medications?
There are. You can have headaches. You can have anxiety, weight loss or weight suppression, irritability, stomach aches. Sometimes there's visual changes. The biggest is usually mood instability when they're coming off the medications. Tend to be really emotional.
Right. So are there natural remedies like what is Valor?
Valor,
Valor?
essentially.
There are. However, I caution parents that if they're going to try that, they really need to talk to a health practitioner that's experienced in prescribing those medications or prescribing those non-alternative treatments, because there also can be side effects if you do not know how to dose them as well.
Yeah.
What's the one thing you think parents need to know about these medications? One thing that they really need to concentrate on?
That is not going to make your child behave the way that you want to behave, especially if it's a behavioral problem. If the child is disrespectful and is having emotional outbursts, ADHD medications is not going to change that. It will control the concentration, the hyperactivity, the impulsivity, but if your child does not want to complete their homework, even after given the medications, the child is not going to complete their homework.
That's just the way
Rosemary,
it is.
thank you so much.
Thank you.
A lot
Appreciate it.
of
Thank
good
you.
information. And if you would like to learn more about psychotropic drugs or Three Lower Counties Community Services, visit our website, WVOC.com. Click on our picture at the top of the page. And when it comes to our little ones, we certainly do want to protect them from all harm. But did you ever think harm could come from a baby monitor? Up next, we tell you the frightening stories of baby monitor hacking, how it freaked out one family and why others are now on edge.
Another hacking actually freezes you out of your cell phone. And guess what? You can't get back into it until you give the crooks what they want. We're going to tell you what that is and how you can prevent it from happening to you. But first, we've been talking a lot about health today. Another disease that many people suffer from is diabetes. Dr. Oz has more on how to manage it.
Hi, I'm Dr. Oz. If you're one of the 30 million Americans with diabetes, it's essential that you eat healthy. Remember the 3 Ds. Downsize portions. Eat less meat and more veggies. Don't skip healthy snacks. They keep your blood sugar levels stable. And dump white foods. Swap out white rice for brown and white potatoes for sweet potatoes.